All right, let's take a look at the Pediatric Ophthalmology book here. All right, shout outs to all of the authors who've worked really hard at putting all of this together. Pediatric eye evaluation, so when you're going to start your pediatric rotation, this might be a good place to start to view all of the different techniques. Pretty much all of these books start out with anatomy and physiology, pathology, and how to evaluate strabismus. Within this section, it's structured a little bit differently than the neuro-ophthalmology side of strabismus. There's a lot of other types of strabismus that doesn't fall within a focal neurologic deficit. So trying to approach it from both ends is probably going to be the best way to think about strabismus. In pediatric ophthalmology, start out with the basics of growth and development, how to assess decreased vision in infants. I think the take home here, just think about how everything's organized. So this is organized almost in the same order as the way the BCSC is organized, right? So you see how even starting out, you've got strabismus, then you've got orbit and lacrimal disease and eyelids, then you go external and stuff. And so even on the BCSC here, you can see here, orbit, external disease, then uveitis, glaucoma, cataract, retina. This is another really great book to read alongside all of the other books. Anytime that you're reading about how to do a certain technique, it's not good enough just to read about it. You need to get your hands dirty. Go in the clinic, get the instruments out, kind of play around with it, see what happens, see what it looks like, understand the terminology, practice describing things, like adduction, abduction, elevation, depression, torsion, all these things. You might even read about it, but unless you're getting comfortable describing it both verbally when you check things out to your attendings or write it down, learning how to document all of that, it's just kind of abstract knowledge, but it's going to be a lot more helpful if you think of it as practical. Here's what you're going to be doing in clinic. I think it's great showing all these pictures, and there might be some videos. Here's an example. Just go and find a trial frame in the clinic, get those Maddox rods, put it on yourself, rotate those Maddox rods, and get a fixation light and see what you see. And that way you get a sense of what the patient's seeing, and then you can describe that to them. A lot of really good images, tables, kind of tying things in, how to work things up. Some clinical pearls. These are now kind of showing up a whole lot more. And it's just because there's been a lot of feedback saying, hey, we want to be able to tie in all of the basic science information to what we're seeing in clinic. How do we think through these problems? They're giving you some differentials. They're also giving you something like this, the Hutchinson triad. So this is all really great.